Hello, thank you. This will be the part two of the video risk factors for osteoarthritis. In the previous video, and I'd encourage you to click the link below to watch, I talked about three risk factors for osteoarthritis. Number one, age. Number two, family history. Number three, obesity. In this second video, I'll be talking about three other risk factors. Number four, in other words, the fourth from the previous video, is previous trauma or accident. If you've had a previous trauma or road traffic accident or fall from a height involving a particular joint, what that does is to accelerate the process that results in you having features of osteoarthritis. And so sometimes when patients begin to have features of osteoarthritis, they can't seem to put their finger on what exactly happened. But if you think back a little bit, sometimes you could recall many years ago, you had a road traffic accident, you had a fall, and what that does is that it accelerates the process. Now, if you had other risk factors, say family history, for which you were to develop osteoarthritis, say at the age of 50, it's possible to then have the osteoarthritis occurring at the age of 40. And so, in addition to other factors that were there, the previous trauma or fall simply accelerates the chance that you will develop osteoarthritis. Now, another risk factor is what I'll describe as joint alignment or misalignment. Now, what people may not realize is that the way the body is, let's say the lower limbs, is structured in such a way that the weight is distributed in a particular way down to the ground. Now, if you have a form of misalignment, say bow legs, we describe bow knees or bow legs, or knock knees, what it means is that the way the pressure or the weight or load is distributed will not be even. I'll give you an example. If you take a look at your pair of shoes, underneath the soles, you will notice that a portion of it is less in thickness than the other. What it simply means is that when you walk, you tend to put a lot more pressure on that side other than the other side. So also when there's joint misalignment, what in medicine we call bow legs as varus deformity and knock knees as valgus deformity. When these deformities are there, the distribution of load is uneven, and so there is a chance that you could develop osteoarthritis of the knees. A third one, which will be the sixth one now. Remember, there's a previous video, and so this is the part two. So the sixth risk factor I'm going to be talking about is hypermobility syndrome. Now, when you observe certain persons that are very flexible in their joints, they're able to carry out certain maneuvers or movements that may be difficult for others to carry out. They may be contortionists. In other words, they can move their hands to their back, they can split, they can do various forms of movements that may be difficult to the ordinary person. Now, that ability can come at a price. Now, what happens is that when they're able to do that, some form of